Hello friends, welcome back to my channel. I am Jamie Canada. I am a student physical therapist who is working in pelvic floor physical therapy. And today I'm going to talk a little bit about pain with sex and some of the options that pelvic PT can offer. A lot of the things I'm going to talk about can be utilized at home, but just as a discretion, it's best to be evaluated by a provider anytime you're experiencing pelvic pain and dysfunction. That way you get the most individualized treatment possible. But I want to start off a little bit about talking through why pain with insertion can occur. So one of the big terms out there is vaginismus. So vaginismus is going to be pain with penetration. How I commonly have seen this in the clinic is pain with sex. So patients might say, oh, my partner feels like they're hitting a wall, or oh, it's really hard for my partner to insert, and then once I'm in, I feel good. Also can be with anything like tampons, finger, you name it, very commonly seen. And what occurs a lot of the time is hypertonicity or tightness of the pelvic floor muscles, especially the more superficial layer. So on this pelvic model, so you have this triangle of muscles that encapture the vaginal opening and urethra, and it's very common that tightness and learned pain response can drive these symptoms. So if you think about it, if you've had some kind of trauma response, or you had an experience of pain with sex in the past, your body remembers that, and it's very common to then, when you do try any kind of insertion, you automatically have this reflex of the muscles tightening and restricting any entry. So there's a lot of things that you can try and utilize with this kind of condition. One of them is utilizing a lubrication. So I will say a lot of patients that come in are like, I know, I've tried it all. So there's water-based lube and silicone-based. If you feel like you're someone who is much drier down there, silicone-based lube can be a great option and doesn't get absorbed into the body as easily. Also, change in position during intercourse or penetrative activity. So trying, let's say you have pain on your back, try and have the knees on your side. Changing up that can be beneficial. Another big tool and a big thing I'm going to talk about today are dilators. So I have a few sizes here. They can look a little bit intimidating. So dilators, this is from a brand called New Flora, the ones that I have. I have a lot of patients that get intimate rose, and there's a lot out there. If you Google dilator set, you'll find it. And so typically they start off at like the size of a finger or tampon, and they can work up to size 8. So really depends on what your end goal is. So whether that's just strictly tampon use, or my partner, my toy, my whatever, it's a certain size, it has a lot of options there. So the idea behind the dilator training is to help promote that insertion in a very gradual way. So starting out with dilators, yes, the goal is to have the dilator inserted and kind of stay inserted, but sometimes it can be a little much to go right into that. So one thing that dilator can be nice for too is just to initially promote touch to that area. So whether it's like inner thigh, and then kind of just placing a dilator opening and then gradually you inserting part of the way and then all of the way, or having your partner do so. So with dilator training, once you're able to get this inserted, your goal is to start with about 5 minutes. See if you can tolerate leaving it for 5 minutes, doing some active movement, so knee sways, some deep breathing, and then working up to 10 minutes at a time. Consistency is really important with the dilators, so we're trying to get those muscles to relax around the dilator and kind of telling your body, hey, it's okay for something to be in here. So once you're finding, hey, it's really tolerable for the first size, then what I recommend is starting 5 minutes with the smaller size and then working up to the next largest size. With that, it kind of promotes that relaxation and a little bit of stretching to then allow for a little bit larger. And then with that, you're once again inserting 5 minutes to start, working up to 10 minutes a few times a day. And this can take, for some people, weeks for one size. Sometimes it might be longer, sometimes shorter. So it's really self-paced, if you will. If you're someone who is like, I'm definitely considering pelvic PT going in, I definitely recommend bringing up, either if your provider, they probably will bring this up, but if not, bring up the idea of dilators, because what you can do is practice in your session, which I have found to be really beneficial. Some patients find that they prefer like the therapist to do the insertion so that they can focus on just the relaxation portion, but it all is person to person. With the dilators, biofeedback is a option as well. So that's where we hook up electrodes near perineum. So it would be like here and here, and that measures the muscle activity. So what we can do is, upon that insertion, we're seeing, oh, what were your muscles doing? Were you able to relax? And finding the best position, breathing pattern to tolerate that insertion. And then once it's inserted, are you able to maintain low muscle activity, or are we finding that it's really hard for you to come back down to that resting baseline level? So a lot of data that we can collect using these in pelvic PT. But just know that there are many options out there. I think starting with like the lubrication, as well as positional changes, are a great way to start, and then working toward more of the devices can be really helpful. With the dilators too, you can provide some stretch around opening, so even a little bit in, pulling down, out, and around, kind of working through those muscles, as well as using this for some muscle release, where either externally, so holding at these superficial muscles, or inserting and kind of moving dilator till you feel points of tightness or tenderness, to then release some of that muscle tension. What you can expect in a PT session, if you're someone who is open to either external or internal work, would be that manual therapy that a therapist would then, with gloved fingers, work to release some of that tension, either superficially or deeper. That way the muscles more relaxed and lengthen, to then have an easier time practicing with insertion. So hopefully that's helpful to give you some idea of the options out there, and know that you're not alone. Vaginismus is very common but not normal, so pelvic PT is a great way to go about getting help, as well as the dilator sets. These can be, like I said, found on Amazon. These are through New Flora, but check out Intimate Roots as well, or anything on Amazon. So comment any questions will you have about any conditions, pain with sex, any questions about dilator training, I'd be happy to answer. But thanks for watching, and I'll see you next time.